Now, you and I have agreed, I think when you used to speak to me on the late night show, we really were so on the same page about what was required and the lockdown, and with regret. I mean, I don't think any of us sort of enjoyed the fact that lockdown
No.
was taking place, but I understood the logic of it. Where I think we probably no longer agree is that 2 years on, I really feel we need to get, and I said it this morning when we spoke to each other on Jeremy Vine's show, this show back on the road. And everything that I have read, all the data I've seen, all the interviews I've done with people from South Africa implies that Omicron is going to be a milder variant. And certainly when we look at the hospitalisation figures for Omicron specifically that we have from yesterday, that would appear to be true. Why is that not the case in your mind?
Oh, it absolutely is the case in my mind, but it's not the whole picture. And I think
Okay.
that's the big difference. So the figures that have come out of South Africa, the best we've got, come from something called Discovery SA, which is 211,000 people who tested positive from one of their biggest providers. Now, the first thing is that South Africa's population is very different to ours. On the whole, it's much younger. The second is that they have had a vast wave after wave after wave of COVID without vaccination. So they're still in the position where only a small minority of the population have been vaccinated, but they are now in the middle of their fourth wave. And to put that into perspective, in Gauteng province, which is the epicenter of the Omicron outbreak as it stands, there is at least 70% positivity in terms of antibodies due to previous infection. So they are very close to having what the government claimed they were never looking for, but actually we suspect they were, which was herd immunity right at the outset.
But then
So
wouldn't that imply a lot of people listening to that, because that is an explanation I've heard before about what's been happening in South Africa. A lot of people would listen to that and say, well, hang on, did we make a mistake then with the vaccine? Because had we gathered our own natural immunity in the way that they have in South Africa by having these waves that we've had to deal with our own natural immunity, we would then be naturally immune to things like Omicron.
well, again, the first thing to point out is that South Africa has got a much younger population, and we know that with every 7 years of increasing age, you double your likelihood of dying from COVID. The second is that the population is nothing like as dense as it is in the UK, nothing like as dense, and therefore the likelihood is that the levels would have been much, much higher. The third thing is that the whole point about not allowing everybody to get infected at the same time, the whole point about circuit breakers, they don't work for very long, but they do just keep things stable for a couple of weeks. The whole point about lockdowns is that they don't reduce the number of people probably overall who get infected. What they do is they allow them to be very much spread out. And the real risk, if you have too many people who are infected at the same time, as we saw in Brazil, for instance, where people were running out of oxygen. We saw the same thing, exactly the same thing in India, where hospitals were running out of oxygen, running out of the most basic treatments. And of course, there were no doctors and nurses to treat them. And they were dying in their droves as a result of their health services not being able to cope. Now, that's what we didn't get in the UK just as a result of lockdown and as a result of vaccination.
However, again, a lot of people would point to the fact that in Gauteng province, hospitalisations are going down, and also the amount of time that people were in hospital with Omicron was about half the time that there was a
Yep,
really interesting article in the South African. I'm not sure if you read it, that
I
explained
did.
about exactly that, half the time that there was with Delta. It also pointed to the fact, as have commentators on this programme, that the South African population, as you pointed out, they don't have quite the vaccination rate anywhere near ours, actually 26%, but
24%, yeah.
they have they have so many more, I think, comorbidities than we do. For instance, things like HIV, things like TB. I mean, they also don't have access to much brilliant healthcare when it comes to their general health, and so surely that puts us in a better position than South Africa.
Well, in some respects, except that, of course, we are a very affluent country, and therefore our incidence of obesity, our incidence of type 2 diabetes, our incidence of people who survive cardiovascular events and live with heart disease is infinitely higher than it is in South Africa. In South Africa, if you have a heart attack, basically you die unless you're lucky enough to have health insurance. So actually, we have got people who've got tuberculosis, we have got people who've got untreated HIV, but there again, I go back this idea their population is much lower, and although they have some risk factors we don't, there are other risk factors they don't have that we do. We are also in the position where we are currently at 93% bed occupancy in the NHS before this started. Now that sounds as if we have 7% bed occupancies to spare, but you cannot put a man who requires urgent surgery onto a female maternity ward. You cannot put a woman who requires ITU onto a standard ward. So actually, it is never possible to get 100% bed occupancy. And the third point, of course, is that it's not just about the beds, because a colleague of mine said recently that if it was all about beds and mattresses, then we'd have solved the problem of the NHS beds crisis or protecting the NHS in the DFS sale in January this year. The simple fact of the matter is, when we talk, for instance, about, say, the Nightingale hospitals not being opened up, that's because you need staff to man them. And exactly the same way, we need staff to man both secondary and primary care. The latest figures that have just come out from the BMA and Pulse magazine show that we are anticipating having 16,000 staff self-isolating in primary care alone by Christmas, and we have a 191% increase, in other words, almost a trebling of the number of people who are off sick and self-isolating as a result of COVID in the NHS in London in the last week.
However, we are seeing, we've just got the latest Omicron daily overview. It's just dropped for the 21st of December. And so yesterday's figures were 129 confirmed hospitalisations, 14 deaths with Omicron. Today's figures, 133 hospitalisations, so 4 more hospitalisations with Omicron out of the 800 or so people that were admitted to hospital in the last 24 hours. Only 4 more of them were with Omicron, and the deaths still stand at 14.
Well, hold on a minute. It takes several days to get the genomic data. So we are running several days behind. That's the first point to make out. Secondly, we do not test everybody who dies to see which version they died from. And when we do genomic testing from PCRs, only about 1 in 10 cases is tested. So if we look at the number of cases we've got, that's a tiny minority of what's actually happening. And we're now in the position
where isn't what's happening in hospitals the most important thing, though? And at the moment,
but the point is that what's happening in hospitals lags behind what's happening in terms of infection. And for instance, if you consider that London is running a week or 10 days in advance of the rest of the country, what we've seen in the last week is an 8% increase in hospitalisations of people with COVID across the country, but a 28.6% increase in hospitalisations in London, where Omicron is further advanced.
A lot of people, though, will look at the hospital data. Today I think it was we saw somewhere in the region of just over 800 admitted to hospital. I think it was something along those lines. Because I'm just looking now at the timeline from April 2020, and that is nowhere near where we were back in January, where it was sort of 4,500 people on some days who were admitted.
3,700, I think, was the highest figure that we ever had, and that was a real concern. That was in March 2021. But we do need to bear in mind that we are now in a position where we have a backlog. We have over 6 million people waiting for routine surgery. If we get back to the position we were in January to March 2020, where absolutely everything stopped and we cannot do any routine surgery, we've already got a major incident in London. We've got several hospital trusts across the country which are cancelling routine surgery because they've got so many patients with Omicron, and we are right at the beginning. And of course, we're just going into the worst winter season as far as flu vaccines are concerned. We're going to have to cancel pretty much all those surgeries, and we may not have 6 million people on the waiting list. We may end up with 9 million people on the waiting list.
So these figures on Omicron, this daily overview, I mean, is it sort of not worth really the paper it's written on? I mean, confirmed hospitalisations, I'll repeat it, 133, deaths at 14, which have only gone up a few this week. I mean, if you're saying that that's not remotely accurate.
Well, no, I'm not saying it's not remotely accurate. What I'm saying is that it's only tiny proportion of what's actually happening, and that we need to wait. If we see in the next 2 to 3 weeks, because that's how long it takes for that huge number of infections to translate into hospitalizations, if we do see that number being very low, and if we see the average age being lower, and we see that the average time hospital being much lower, then I will be delighted to say, okay, let's get back to normal, let's try to live with it. What I'm saying is that we have consistently in this country left it too late. We left it too late in the first lockdown, we left it too late, far too late in the second lockdown. That's why we ended up in the problem with the third lockdown that we had. And if you remember this time last year, only a week ago, in terms of this time last year, the Prime Minister was saying it would be inhuman to deny people the opportunity to have Christmas with their families. He was then forced to backtrack completely, and by that stage it was too late.
So when is that moment then where we say, okay, actually it isn't so bad, or it is the disaster we thought?
So the answer is, I think we should absolutely have stopped, say, 10 days ago. Personally, I cancelled everything that was going on in my family. I cancelled my Christmas. I cancelled everything that was going on over this 3-week period, about 10 days to 2 weeks ago. And I think that when we've waited for high levels of infection, and of course it became the dominant variant in London about 10 days ago, and we're now in the position where Northern Ireland, Scotland and England, it's the dominant variant, give it 2 to 3 weeks after that. If we are not seeing significant increases in hospitalisation, I will be only too thrilled to say, yep, we got it wrong. But the point is, can we risk being too late and saying, we got it right, so we told you so, we've done it before?
Finally then, firstly, is Boris right or wrong to say, go ahead with your Christmas plans? And secondly, do you believe him when he says that this will actually be happening?
I wouldn't believe Boris Johnson if he told me the sky was blue. I'm afraid, given what we've seen recently, and I think there are an awful lot of other people out there who wouldn't believe it either. If you look at what he has been saying over the course of the last 10 days, 2 weeks ago, Jenny was roundly told off by Boris Johnson for saying exactly what Boris Johnson is saying now. 1 week ago, Chris Whitty was roundly told off by various members of Parliament for saying exactly what Sajid Javid ended up saying 3 days later.